Among the numerous barriers that patients with chronic pain experience with regards to participating in pain psychology treatments, probably none is more powerful or as pervasive as the belief that seeing a psychologist means that their pain is in their head. This common stereotype about pain psychology, no matter how false, makes it both difficult for physicians to talk with their patients about pain psychology referrals and makes it difficult for patients to accept them. For a patient with chronic pain, probably already impacted in many areas of their life by their condition, the implication that their pain symptoms are psychological is insulting to their daily struggles and probably demoralizing to their hopes for treatment. The usual response by healthcare providers to a patient uncomfortable with a pain psychology referral is to educate them about the overlap between chronic pain and mental illness, or to describe the research supporting the benefits of pain psychology treatments. As well-intended as these latter approaches are, however, they are frequently ineffective, resulting in declined referrals and missed pain psychology appointments. A more persuasive approach for the provider when discussing pain psychology options is to use one or more analogies that demonstrate the direct connection between the biology and psychology of pain. In the same way that a picture is worth 1,000 words, a skillful analogy can sometimes illustrate the benefit of a pain psychology referral much better than a lengthy educational effort. This video will describe multiple analogies to help providers diffuse the myth that psychological treatments are useful only for patients whose pain is in their head. The first set of pain analogies refer to the ways in which our basic biological drives express themselves through our psychological experiences. We experience these signals strongly in our psychology, but they are based on underlying physiology. Pain is one of these biological drives, acting as a kind of alarm signal that compels our attention and motivates behavior to address the source. Without pain signals, we would be ignorant to injury and illness and likely live much shorter lives as a result. But pain is just one of these survival drives that work specifically by entering our awareness. Hunger and thirst, for example, are also essential signals that help us to maintain the health of our bodies. Underlying hormones and other chemical mechanisms help our bodies monitor our need for food and drink and trigger feelings when deficits in energy and fluid levels arise that we call hunger and thirst. Hunger and thirst are no more in a person's head than is their pain, yet all three create a distinct psychological experience. For example, we salivate and experience desire at the sight and smell of food. However, even though hunger has a clear biological basis, it also has a psychological basis. A psychologist may be of great help to a person who struggles to control their food cravings, for example, or who is trying to lose weight, just as a psychologist may be of help to many patients struggling with chronic pain. The universal experience of sleepiness that we experience after long periods of being awake and fatigue from overexertion are two additional life-preserving signals that are produced by the biological machinery of our bodies, yet we experience them in part through our psychology. Even though sleep is a natural biological function, sleep is often compromised by psychological factors such as stress, and it is often best treated by behavioral sleep experts rather than by medicines. The second set of analogies represent ways to relate physical pain from injuries and diseases to emotional pains that we experience from negative events in our lives. Even though people think of emotional pain as being different from physical pain, these pains are in fact regulated by the same areas of the brain and involve most of the same neurotransmitter systems. From their shared biology, it makes sense that both physical pain and emotional pain both have an important psychological component, and that they could each at least be partially treated from a psychological approach. Slide 3 here lists several types of emotional pain that have a well-documented biology. Even though emotional pains are experienced by us as feelings, they can have profound and even dangerous physical effects on our neurochemistry and even our organ function. The pain of social rejection can be clearly seen in the brain scans of an MRI, for example. Testosterone levels are known to decline and heart attack rates increase among fans of teams that lose in major soccer games or who are fans of Super Bowl teams. And the condition commonly known as broken heart syndrome is a studied cardiovascular reaction that can sometimes even be fatal among those suffering from intense loss or sadness. The connection supported by each of these analogies is that pain of any form has both a physical and an emotional component, whose treatment could often be aided by a provider skilled with psychological approaches to pain management. The next set of analogies represent ways to compare the experience of physical pain to other types of experiences that also have strong physical and emotional components. The examples from this slide can be useful comparisons to show how the body and mind work together for symptoms such as pain. When emotions are poorly controlled, just as when pain is poorly controlled, they can often be treated by psychologists as well as by medical providers. The experience of nervousness on a date or other special social occasions is nearly universal among people. Yet this emotional experience is produced by our sympathetic nervous system responding to perceptions of threat. Love was so consuming as to drive Romeo and Juliet to suicide, and fear can be so powerful as to paralyze an animal despite being in front of an approaching vehicle. Yet both love and fear are feelings produced by the biological activity of our brain and nervous systems. Anger is considered an emotion, but it is such a powerful physical state as to even be able to change blood flow patterns in our bodies. For example, the red-faced expression, common when a person becomes very angry, is produced by the brain directing blood to our upper body to help us prepare for potential conflict. The opposite happens with fear, where blood is redirected to the legs to support evasive maneuvers, providing a biological explanation for the expression, "You look like you have just seen a ghost," referring to a person in a state of intense fear. When fear is strong enough, it can even cause us to faint by reducing the amount of blood and oxygen in our brain. With these and other examples involving strong emotions, there is a clear comparison to the way that we feel pain and the multidisciplinary ways in which we may approach treatment. This fourth and final set of analogies refer to some of the many medical conditions that not only have strong psychological components, but that are often even best treated by psychological rather than medical interventions. No one who has experienced a headache will dismiss them as something existing only in our mind, but most of us have experienced directly how stress and tension can cause headaches or at least make them worse. You can take medicines when you experience a headache, but learning to manage stress better might prevent them entirely. Insomnia is a medical condition affecting millions of Americans, yet it is best treated by a psychological treatment called cognitive behavioral therapy for insomnia, or CBTI as commonly abbreviated. Emotional stress can increase blood pressure, such as in white coat hypertension, and affect blood sugar regulation among diabetics. Studies also show that psychological factors such as stress and social support greatly affect our risk of developing a cold or flu, even when everyone has been exposed to the same viruses. Finally, the fascinating case of voodoo death appears to be a psychologically induced reaction caused by the belief that one has been cursed. Regarding the examples shown here on slide 5, each demonstrates the common role that psychological factors play in physical health problems and suggests that the treatment of these health problems may benefit from psychological interventions.